Good morning, everyone. Still quite early for a keynote, but let's try to do that. Okay. Right, so let me first thank you for the kind invitation, IHE-Europe, for the kind invitation to invite me, as well as the Greek delegation. We're all delighted to be here. We'll have a quite strong delegation this week here, and I'm sure you'll meet all the people and try to exchange as many experiences as possible. So let's try to see if that works. Right, a few things about myself. I'm Ioannis Kotsiopoulos. I'm the Secretary General for the Greek Ministry of Health, and my role is to run the Greek healthcare system, especially the hospital sector. The role is mainly political, but also quite operational. But some of the things that we have been doing are also quite technical as well. So I'll go through these things that are relevant today. So 20 years ago, I started working on eHealth, and I started doing my PhD on semantic interoperability in service-oriented architecture. So that seems even today quite interesting, given the fact that we're still talking about the same things, and some of the challenges that we are facing today had been similar 20 years ago when I started doing this piece of work. If some of you might have experienced the same difficulties with the first .NET frameworks and web services trying to talk to each other. So still quite, things have moved on, but it has been fun. So I've spent quite a few years in the UK and also a few years in the NHS, apart from my academic career. And the last few years I've been working as the Secretary General, and I was lucky enough to have to face the biggest crisis due to the pandemic. So that has been quite interesting as well, as you can imagine. So, so the challenges for the Greek healthcare system, I'm sure that other healthcare systems might be facing similar difficulties, and I'm sure you've been thinking of the same things. So funding, aging population, shortage of healthcare professionals, and the pandemic crisis, which seems to be in a better kind of, seem to be in a better position right now, but still, I don't think we have been through that completely. And to give you a few numbers, Greece has been one of the countries that have been suffering from a huge financial crisis over the last 10 years, as you can see in these nice graphs. So have been well below the EU average in terms of spending on our healthcare system. So as you can imagine, the Greek health crisis started about 12 years ago, and the pandemic started 2 years ago. Imagine the challenge that we had to deal with, having a healthcare system that had been under-financed for 10 years, lack of morale, lack of staff, lack of equipment everywhere. So it was a huge challenge for us, to be honest, but I think we did manage to pull through, and I think given the outcomes, I think someone forgot his glasses here. You want? Okay, there you go. It's fine. I've been looking for them. Fine. Well, I can't use them, I'm afraid. Excellent. So, aging population. Greece is a nice place to be if you want to visit for holidays, so please take the opportunity to come and visit us. But also have a quite aging population, which means that our challenges for the healthcare system are quite severe, because you have to deal with older people, frail people, have to look after them, and as you can understand, that will put even more pressure in the next few years. Now, that's kind of, if you look at the World Health Organization and the kind of and the challenges that they have been kind of informing all the states about the future challenges, I think the lack of healthcare professionals is one of the biggest one, and also the movement of healthcare professionals between member states and also across the board. I think, if you ask me, I think that will be the single biggest challenge that we'll face in the next few years, given that healthcare professionals are not very well paid. They are hard to train. They are not very motivated, especially after the pandemic. So we are starting for a very kind of low point. So we haven't got enough, and we can't find them anymore. So we recruited about 18,000 people over the last 2 years, which is about 20% of our healthcare force. But to be honest with you, we're running out of people interested to join the Greek healthcare system. So that will be a huge challenge for the next few years. So we'll have quite a lot of slides, so I'll be going quite quickly. And I know it's still early in the morning, so bear with me. If you can't understand something, please stop me, and I'll explain a little bit more. So when we started with the pandemic, we also started with lack of ICU beds, lack of preparedness. So it has been a struggle. But let's move on with our digital stuff, which might be more interesting. So while all this was happening, we thought one way to deal with things is to do things differently. So why not use technology more, and why not try to kind of reinvent how we do things in Greece? So we started with our COVID kind of response in Greece, and we have been working with the Greek Ministry of Digital Governance. So in Greece, I think it's similar in other member states. We have the Ministry of Health and we have the Ministry of Digital Governance, which in a way is the IT department of the government, but they do tremendous work in terms of digital policies as well. So we have been working together with them to produce different tools to tackle the pandemic. So we introduced paperless e-prescriptions so that people didn't have to go to their GP to get their prescription. We have COVID registry in every single hospital in Greece. We have been using business intelligence tools to predict pressure on the Greek healthcare system, to do data analytics. Quite a few tools, if you can see there. So for us, the pandemic was a challenge, but also an opportunity to do things in a different way. So we pushed things because of the pandemic. And I think we were fortunate enough to have quite good leadership very good leadership in the Ministry of Digital Governance. So we produced a huge variety of tools for our citizens. Of course, we learned from our mistakes. I hope that we're getting better. And one of the things that I wanted to share with you is that we discovered on the things we did from scratch, things were much better. So in terms of our vaccination campaign, what we did was we applied the principle digital first, because it was a new process for everything. So we thought, let's rewrite the process. So everything was digital. The booking of the appointment, when patients visited, or not, citizens visited all these kind of new facilities, all the processes were completely digital. And that really helped the population understand, the interaction between the state and the people in a different way was completely new to them. And I think they really understood digital health from that single experience. So, of course, in Greece, there have been quite a few tools in the past. So there were quite a lot of eHealth applications in the past. I think the single biggest and most successful example was the eHealth, the e-prescription. Sorry, 8 minutes. So doing okay, I think. It's the e-prescription system, which is national. So if you want to get your prescription from your GP, everywhere in Greece, you can go through this national system, and it works very, very, very well. And as you can see, there are quite a lot of services. So almost a million transactions per day right now has been very well accepted by the population. Very successful, and I think the delegation here in Greece will try to demonstrate some of that stuff. We have been trying over the years to develop a national electronic healthcare record, and that has not been very successful for different reasons, and that's something we can start sharing with you. But we have a very ambitious program to rewrite that completely. Hospital information systems, are people here working in hospitals? Yes, quite a few, and I think quite a few vendors from what I understand. So we have quite a few hospital information systems. If you ask me, they cover some of the functionality that we would like. They are not anywhere close to a paperless hospital. We still have a lot of paper-based processes, but because of the financial crisis over the years, what we tried to do was to try to almost introduce technology to monitor how the financial status of the system. So we're mainly covering our finance department. So we haven't been really developing the healthcare aspect of our of our system. So mostly clinicians write down things on paper. So I think it will be a challenge to try to move people towards a paperless healthcare record over the next few years. So health data, as I said before, as you can infer, we'll have a lot of data from prescriptions. So we know a lot of things about the prescribing habits of our clinicians and also a lot of things about our population. But we haven't got a lot of data, clinical data from our hospital sector, which is a little bit sad because this is where you get a lot of information by looking at data from your hospitals. So the strategy, you can probably guess, we think it's not a hype, but it can be a game changer. So the strategy here is, first of all, to upgrade the infrastructure in the hospital sector. So all these applications that we have, we really need to think about how can we improve the digital readiness of the hospitals. In terms of technology, obviously what we want, and obviously this is kind of an EU-wide initiative, is to have open architecture, to be the ability to exchange data rather than introduce big, huge clinical systems everywhere that are closed and cannot interoperate. We have huge emphasis on people because, as I said before, we want to create an environment where clinicians and healthcare professionals want to work, and we want to improve the conditions there. So it's, for us, technology is one of the ways to attract healthcare professionals. And of course, to have an outward mindset, and this is one of the reasons why I'm here, is to make sure that we learn from other people like you guys. We hear best practices. We try to communicate our strategy as much as possible, and also evolve the strategy over the years. So us, the Ministry of Health and Digital Governance, sat down and wrote what we call the Bible of our transformation. Now, it has been written 3 years ago, and probably we need to refresh it a little bit, but it's still quite valid. From my point of view, and perhaps from a citizen's point of view, if you think about technology, it's almost irrelevant. And I'm trying to provoke a little bit the discussion. What we want here is to use the technology to eliminate inequalities in access. We don't really care about the technology, but if technology can help us provide better service to the population, yes, we're really interested. And also, what we want is to create a different experience. I said before, what we tried with the vaccination campaign is to try to use a different experience, is to try to create something completely new. Instead of going through a paper-based process, use your app, use something that will make your life easier. We have introduced quite a lot of applications over the last 2 years that have completely changed how we perceive access to healthcare services. And the third one is, can technology be daunting for the healthcare professionals? Yes, it can be. But can technology be a reliable partner of the healthcare professional? I think if you do it the right way, and if you convince clinicians that technology can actually help them detect, for example, tumors early on, rather than relying on an experienced healthcare professional, just to give him or give her advice on whether this tumor is going to evolve on the next 5 years. Yes, but if you're trying to push things too hard, then you're not really making technology a friend. And the third one is, how can we make sure that technology will make our hospitals safer? And I think we really need to be very careful on how we introduce technology in the healthcare sector, because we have seen examples where things didn't work as well as we expected. And I think the problem we discussed earlier, it's not about the technology, it's about change, and it's about people, and sometimes it's about politics as well. It's how you introduce things. Technology can work, and I think we have seen fantastic tools around that 9 out of 10 times would work in any environment. But the challenge here, and I want this to stay with you, is about business change and how we make sure that we take clinicians and patients on board. Now, Another thing that happened because of the pandemic is that Europe realized that we have an opportunity. We have to invest back to the NHS in every healthcare system, because we realized that our healthcare systems were supporting the economy. If they failed, everything would have to stop. So, most of you are from Europe, right? Yes, there are a few US people, exceptions, but you've heard the Recovery and Resilience Fund, and we successfully applied to a huge grant from the Recovery and Resilience Fund, almost 350 million to upgrade digital technology in the Greek national healthcare system. So the first priority, how can we make sure we have a national healthcare record that is fed with healthcare data from the hospitals? Huge interoperability challenge. We have about 130 different hospitals in the public sector, around 30 or 40 in the private sector. How can we make sure that the digital healthcare record that we have at the national scale has all the data from the underlying systems? And that's a huge challenge for, I think, today's conference, to make sure that when we create our architecture, we use the best examples for interoperability. And also, it's not about just exchanging the data, it's about the semantics of the data that we exchange that are not always the same, and I'll talk to you about this in a couple of slides. Cancer, huge initiative in Europe, Europe's Beating Cancer Plan, our initiative to upgrade the infrastructure for oncology patients in 10 Greek hospitals, completely rewrite the processes, make them completely digital, so the oncology patients will need to have a completely different experience when they visit an oncology hospital. It will be a huge challenge for Europe, it will be a huge challenge for Greece. Hospitals, I talked about hospitals before, aging infrastructure, we need to invest a lot of money. Number 3 is possibly the biggest pot of money, it's about 150 million euros, sorry. And I think we need to do a lot of work there. Telemedicine, I'm sure you've heard Greece has quite a few islands. I don't know if you know that has quite a few mountains as well. So we'll have aging population all over the place. And most of our hospitals are based in Athens and Thessaloniki, some of them. So the challenge here is, how do we make sure we provide the best access to people in remote islands or mountainous areas? So telemedicine is something that has been working fairly poorly in the past. We have some infrastructure, but again, it's not the technology, it's how do you make sure you integrate telemedicine on your existing clinical processes within the hospital? So a clinician somewhere in Crete, how can we make, even Crete has big hospitals, I'll use Mykonos, I don't know. How do we make sure that a clinician there, when he needs help, he can access a healthcare professional in a Greek hospital at that point in time? So it's about creating different processes. And also, we're completely changing our national insurance fund, make also the processes that are quite difficult there, also completely digital. I talked about cancer, so I won't stay with that for too long. So interoperability. So when we designed this kind of submission for the Recovery and Resilience Fund, we thought that the best architecture would be to create a federated system that would need to interoperate with every single hospital. So the national interoperability framework is at the heart of what we want to do. So I guess the work that you have been doing this week is possibly very, very interesting for us. So we want alignment with all the EU standards, and also we want to have an agile architecture that we can actually modify as we introduce healthcare reforms, because this is what we're planning to do over the next few years. And also, we don't want to be reinventing the wheel. I'm quite happy if we use the best examples around Europe. And to be honest, some of the things that I've been using were kind of influenced a lot from my experience in the UK and the local healthcare records there. So Alex will probably talk to you more about these 3 projects, but when I started there, there was an opportunity for us to participate on these interoperability projects. So I said yes and committed quite a few people from the Ministry of Health to be part of the work. I think there was tremendous interest from our community to participate. I actually didn't think so, to be honest, at the start. But as I can show you later on, we had a couple of use cases where we worked with, especially with our lab information systems. I said before, we want to start from some easy wins, some quick wins. So a quick win would be, let's try on the National Healthcare Record, pull all the data from the labs, from the private diagnostic centers and the hospitals. So the labs do produce fairly structured data, even though some semantics sometimes differ. But I think it's a challenge that we can handle. But let's try to pull all the kind of all the data from all the lab tests and see what we can do. So we started with two almost straightforward, or the most straightforward use cases. And we had a lot of participation from the Greek hospitals. And I think we have now finalized the work. It has been submitted to the Ministry of Digital Governance. And I think it will be the foundation of our next step. So actually we have started introducing our national healthcare record on our app. So what citizens will see, instead of carrying printouts of their lab results, they'll see the results in an app in their mobile phone. So next time they'll go to see their clinician, suddenly they'll see, oh, what a huge difference. I can inform my clinician, and the clinician can actually look all my lab results with a single click. And guess what you do? You start building trust. So then we're thinking about introducing images. So instead of carrying your x-rays again in a bag, let's try to have a national repository where we talked about that earlier. We can actually have all the images there, and that has been work in progress. So I think within the next few months, we'll be able to demonstrate that to all our citizens. So as I said before, huge interest from the community. We involved everybody, 45 minutes, even meetings, even though the pandemic didn't really help because we couldn't do the hackathons. Even though it was a difficult time for us, we still tried to do the hackathons online, and a lot of people participated, training programs. What I'm trying to convey here is I think the community is ready for what we are trying to do, and what we are trying to do. I think you're working towards the right direction. We probably need to do more of that. Again, that's more details about the projectathon that happened in Greece, and I think we have plans to do more in that direction, right, Alex? Now, you are all aware that there is a legislation that has been discussed at the EU level, and how can we make sure we exploit the data, the health data, in the right way. The EU health data space has been a very interesting topic for us. We have been working with our EU partners on this, and we also want to create our own policies, and I would be very interested to talk to you guys about the legislation that is going to be submitted, I think, for a vote in the next few months in the Parliament. So that's work in progress, but I think it's very relevant to interoperability and very relevant to how we redesign our healthcare systems based on the evidence that we have, the clinical evidence that we have. How do we make sure that we exploit the data for precision medicine, for example, for pharmaceutical policies, for population health management? I don't think we do that very well at the moment. So I think that single piece of work is really interesting, and it's probably going to pave the way for what's going to happen in Europe in the next few years. Now, challenges. As we said before, am I running out of time? No, not yet. Challenges. When I started working on eHealth, I thought the problem is, completely technical. I thought, Microsoft hasn't introduced yet a great package for web services. But 20 years later, I think my PhD is still valid, but the challenges are completely different. The challenge is politics. How do we get consensus from all the stakeholders to make sure that we're all kind of adhere to the same agenda? legal. There are also quite a few legal challenges that, from an engineering point of view, it's completely irrelevant. But if you look at the legal implications of what we're trying to do, they're huge. So don't underestimate on the work that you are doing that there is huge work to be done on the legal front. And I realized that more in my last 3 years as a member of the government, that every single piece of work that we had to do at the technical level, and the Greek delegation will tell you that we had to write a new piece of legislation. It's a bit crazy, but that's the reality, and we had to spend a huge amount of time trying to convince lawyers to make sure that whatever we did was legal, especially because healthcare data is so sensitive that, you know, there's a also kind of great reluctance, if I may say, from the legal experts on this particular topic. So possibly what we need to do at the European level is try to do things, try to legislate more at the European level and less at the national level, so that we get a very solid legal framework at the EU level, so that we have less national legislation. Now, that's one of the slides that I love more, because it says organization culture, its strategy for breakfast, lunch and dinner. And I can tell you that this is true both in the UK, that I've spent 15 years of my life, but also in Greece. And I think it's even more challenging in Greece, because even though it's almost like a greenfield experiment, because you haven't got a lot, you still have the culture that you need to change. And don't underestimate, you know, the kind of the pressure that people will put on engineers when you develop digital solutions. So for me, the goal still remains ideal patient care, and there is a kind of a fine balance on how you can push the organization culture to introduce new things when at the same time you want to change the agenda. Now, time management, I think we talked about this before. We have to implement this huge program over the next 5 years. This is common for everywhere around Europe. The Recovery and Resilience Fund needs to be implemented within the next 5 years. But also we need to think of the future. What happens after this, after when we run out of the funding from the RRF? Leadership, do we have the right leaders in the NHS, in the Greek NHS, to make sure that we have sustainability? Are we building the right leaders to, for example, make sure that they understand that interoperability is at the heart of our digital strategy, and do things in the right way? Because you can easily create the kind of the wrong leaders. And also, let's not forget about the end users. We are all working for them. I think what they need to experience is a completely different reality. Right, I think I'm running out of time. So I know there are quite a few vendors in the room, but what I wanted to say here is there's a huge opportunity for vendors to come and show the products of Greece. There will be tenders opening up soon. So do participate. We want to see your solutions. It's an open market. What we want to create is an ecosystem of really innovative applications. I'm sure you've seen the European priorities, so I won't talk about that. So there are quite a few opportunities ahead. So let's talk about what we can do about the future, how we can use your experiences, how we can use best practices. But let's not underestimate the threats as well. There are huge, as I said before many times, there are huge threats around. Let's try not to be too optimistic. Let's exploit the quick wins, get the trust of the citizens, the trust of the politicians. You have my trust. And also, let's try to change organization and culture, because this is going to be the challenge of the future. Thank you. I know it's still very early in the morning. Thanks for taking the time to listen to my thoughts. Thank you.